These medications are generic medications, and so they're not very profitable.
Meantime, cancer patients are facing dire circumstances as drug shortages are leading to potentially life-threatening delays, meaning some patients could die waiting for the critical medications they need. NBC's Berkeley Lovelace is here with new reporting on this story. The FDA says they admit 4 drugs are in short supply. What are they used for?
Yeah, so there are 4 drugs in shortage, and so 2 of them are common chemotherapy drugs. Another is for prostate cancer, and another is for bladder cancer. And so basically what happens is people get put on a waiting list. We spoke with one patient who has stage 4 prostate cancer, and he's been waiting for this drug for about 2 months now.
What? I mean, what are these folks telling him? There's probably almost no one watching who doesn't have a loved one or a friend at some point who hasn't battled cancer. The idea that you need treatment and you can't get it, what are they telling you?
Yeah, it's really devastating. So the doctors are really on the patient's side here. So they will put in notices and ask for the drug manufacturer to let them know as soon as possible when the drug comes in. But a lot of times the patient is just kind of left hoping and waiting for this medication. So along with one of the patients we spoke with, he's basically, holding out hope that this medication comes through, but his family is also concerned. His cancer is still growing, and they have no idea when this medication will be able to
So what is causing these shortages, and do we have a timeline?
Yeah, so a lot of it's a lack of investment from manufacturers. So a lot of these medications are generic medications, and so they're not very profitable for drug companies. And so there's a little bit of a lack of investment there. There's also concerns about poor manufacturing at U.S. factories, and then also drug companies being transparent about where these drugs are being sourced from. So a lot of drugs are now being sourced overseas, and the FDA has a hard time actually being able to go and see how these drugs are being manufactured.